Okay, this is especially for those of you who've had frozen shoulder or a shoulder surgery or just a simple impingement in the shoulder from rotator cuff issue, and you've lost your abduction from about, say, 70 to 90 degrees, meaning you can get to here okay, but to get to 70 to 90, what you tend to do is hitch the shoulder. Now that's familiar for you, where you go to here, and then when you come up, you start doing this. Then I've got an exercise for you, especially for those who are a little bit weak. Normally what we do is we'll put, say, a band overhead somewhere. Now you can hook this over a door, that sort of thing. Normally, for people who've got a little bit of strength, we put that, say it's my right shoulder, I'll put it over to the left. And what I normally do is have this as my lifter. So what I can do from here is let it come up like this, okay? Now, this is normally good for people who want to go all the way up, okay? They're trying to get their control better, right? So they're working on keeping their shoulder down, letting this come up. They've got the range there, and then they slowly let their shoulder lift and guide them through. Now, this is pretty common with people with scapulohumeral issues where their shoulder blade is not quite abducting correctly. But for those of you who are struggling with just the lifting part, so if you get to the point where you haven't got enough strength to lift up, and maybe this is you're early on the program as far as your recovery for shoulder surgery or injury, and you can't even lift there, then what I suggest you do, simple fix. This one you put to the right side, meaning if I'm using my right shoulder, you don't put it on the left, you put it on the right. That's the trick. So if I put it over here instead, and sometimes you might have to use a double band because you need enough drag up. The trick with this one is we're trying to do passive abduction, okay? So the contraction part is adduction. With most people with all shoulder injuries, that movement is fine, okay? They don't have any problems pulling down. So depending on how much strength you've got to pull down will determine whether you're going to use a double there or you maybe use a single. You might have to use a stronger band than perhaps a yellow, but even that's enough. If I let that go, just pulls me up, all right? So what you do is you start down here, okay, at about 0 degrees, abduction, and you let this come up. So you let the band from there drag you vertically, right? What this will allow you to do is get a direct pull upwards rather than being from over there, but also allow you to focus on keeping the shoulder down because we're after pure abduction of the shoulder. Remember, from sort of 0 to 60, the shoulder blade is not supposed to move, all right? Then from 60 upwards, the shoulder blade is going to abduct. What I want you to focus on is try not to let it hitch early. Okay, so when you normally lift up, if you've got tightness in the shoulder and a loss of range, you'll hitch early. So what you try and do, put this hand around the back and feel your shoulder blade here. Okay, so you can feel that shoulder blade sitting down on my thumb. You keep it down on the thumb, okay, from here, and try and focus. If you keep the shoulder blade down on the thumb and then let the band take your hand up, what you'll get is abduction through the shoulder joint without movement of the shoulder blade, okay? And then you just pull down to return. So I'm monitoring what is that, if this is my shoulder blade, like that, I'm monitoring whether it comes away or not, okay? So you do try and keep it on that thumb. Then you don't have to worry about lifting because most people, if they try and use their rotator cuff and their deltoid to lift up, all right, the brain tends to hitch the shoulder and use the trap. This will stop that from happening, okay? So from here to here, you'll be able to go, okay, keep my shoulder blade down. Some people put it around the back, some people put it on top and go, keep it down, keep it down, keep it down, keep it down. So here, I'm not using my deltoid. See, it's not even working, all right? I'm using muscles underneath here to control the abduction movement. And then I get to the point where I'm sort of, it's going to rise and then I pull back down again. Now, if you really want to work on the actual pure movement into abduction, you can try and focus on keeping it locked down all the way through to 90 degrees, okay, as long as there's no impingement pain, okay? You might find that you don't have enough range in the shoulder to do that, but for those of you who've got a bit of range and it's more of a movement compensation issue, you can try and hold down, let the band take you up so you're getting good movement through the shoulder, joint and then pull down again, okay? Of course, this one you don't, as soon as you get to there, the tension's gone, okay? So this is only for sort of 0 to 60 and then 60 to 90 degrees. If you then need to, like I said before, go above to 180 and work on your movement of that shoulder blade and get that patterning right, you put that band back over to the other side and do the one as normal. So there's my little tip for that. If you're struggling with your abduction, which a lot of people do, you know, they hitch too much here, try this as your movement pattern work, okay, to see if you can get some movements through the shoulder neuromuscularly to improve your patterning of movement, stop you overcompensating with upper trap. See how that goes. See you next time.